Welcome to Catholic Matters, an hour of information and discussion on life and family issues and the trusted guidance of the Catholic Church in our daily lives. And now, here is your host, Patti Staley.
Welcome to Catholic Matters. There is a reason that for centuries physicians have held such high regard within society. The reason is their vocation is an extension of the healing power of God. They must study the divine plan for the human body, mind, how health can deviate, and God's revelation in how to heal that has been revealed through scientific discoveries throughout the century and even to our own time. It was Saint Benedict who began the correct model for holistic care for the lifespan. In establishing his order throughout Europe, he designed there to be a monastery as the house of prayerful sacrificial living, which supported the people of the town. There was a school for educations of minds and souls, and a hospital for the alleviation of suffering. Thousands of monastic models have been established throughout the world, and it gave birth to hospitals everywhere. In an effort to heal others, through physicians, nurses, and other healthcare providers, as well as caregivers, it is essential to offer proper care in truth, in love, and in Christ. How that is done well will be discussed today by our guests, Dr. John Travaline and Louise Mitchell, authors of the book Catholic Witness in Healthcare. Welcome to Catholic Matters, John and Louise.
Thank you. Good to be here.
Thank you, Patti. It's nice to be here.
So pleased that you are here. I'd like for you to tell the listeners a little bit of your background so we can understand what your expertise is as we begin our conversation. Louise, would you start off? Louise Mitchell.
I live just outside Philadelphia. I have a Master of Theological Studies from the University of Dallas. I was a computer programmer for 18 years, so that was kind of odd. But I went into theology after that. I have an MA in moral theology from Ave Maria University, and I'm currently working on a PhD in bioethics from John Paul II Institute in Melbourne, Australia. I'm also a lay Dominican, and I'm vice president of our chapter in Philadelphia at Holy Name of Jesus Church. And I'm the associate editor of the Linacre Quarterly, which is the journal of the Catholic Medical Association. I've been with them for over 10 years. And I'm a professor, adjunct professor at the University of Mary in North Dakota. I teach an online course in medicine and bioethics.
Excellent. And Dr. Travaline, how about yourself?
I'm from Philadelphia, grew up in Philadelphia, now live in a suburb of Philadelphia with my wife and children. I went to St. Joseph's University in Philadelphia, studied biology and theology, and after that, medical school at Jefferson Medical College, which is now the Sidney Kimmel Medical School of Thomas Jefferson University. But back then it was Jefferson Medical College. While in medical school, also took graduate studies at the Villanova University in religious studies. After graduating medical school, did internal medicine training at the University of Maryland in Baltimore. Came back to Philadelphia for the last leg of my medical training, which was in pulmonary medicine and critical care at Temple University in Philadelphia. And after completing that training, remained there, became a faculty member, and I've been there since then. That was in 1994 that I completed my training, and I've been at Temple University since then.
So as I listen to both of you, I hear that there was kind of a parallel in education and faith your entire, your last several decades. In how does one form the other? How does one relate to the other in your own personal life?
When I was in my, early 30s, I'm cradle Catholic, and I realized that I believed all this Catholic stuff, but I didn't know what it was. I didn't understand what it was I was believing. And so that inspired me to go study theology and to get my master's. And knowing more about my faith caused my faith to increase. So it's been kind of a cycle. They each feed each other.
Yes, they do, don't they? Definitely. Dr. Trevelyan, as you as well, or what was your experience really?
Similarly, I too am a, quote, cradle Catholic. I sort of date a conversion, if you will, meeting Jesus Christ in those formative teenage years. As a junior in high school, I distinctly remember a particular encounter. And since then, it's been an ongoing, and it continues to be, journey of getting to know Jesus and to know about him as well through studies and religious studies and theology. Going into medicine, which was a desire, a goal, objective of mine from very early on, even before my faith experience. I quickly saw how the two mesh very nicely in care for people in the medical profession, recognizing also the spiritual dimension, if you will, that is part of all of us, and began to see that, and I continue to see that more as I practice medicine. So sort of paying attention almost in a parallel fashion, if you will, to both of those dimensions of the human person.
So, Dr. Trevelyan, you know how in medical schools, nursing schools, the model of the holistic person is really central, even in a secular school, of looking mind, body, soul. Maybe they would say spirit. I'd like to say that we have to put that to ourselves as well. Louise, I think you'll be able to help us with this thought. We're very directed in patient care holistically, but we have to consider ourselves holistically as well, because we are made up of mind, body, and soul. And as more we develop the soul, the more we read good spiritual reading and understand the church as Christ has formed it, the more our scientific mind will open, the more our legal mind will open. They play off each other. They supplement each other. The more your soul is open, especially with the working of the Holy Spirit, the more you can accept truth, and the more truth will be evident. Now, why am I saying this at the beginning of a talk on Catholic witness in healthcare? It is because we live in a very secularized society, and our physicians and our healthcare practitioners are in that society as well, and can, because of busyness, because of peer pressure, yes, even in professions, we may step back from our faith, or feel that we have to keep it so far in that maybe we stop attending Mass or we stop praying. But when that closes up, so does parts of our mind and our hearts, and that feeling of the knowledge of truth coming in. We kind of stop growing as a person in many ways. So as we talk through this show about the realities of healthcare today and how we can be Catholics in that situation to be the best for our patients and for people who are suffering, we have to keep in mind ourselves that development of our own spiritual life is going to make us better doctors, nurses, ethicists, everyone that has to do with people who are ill or suffering on their journey to wellness. Mm-hmm. So let's start in one place. In each of your professions, whether it's education or practice of medicine, describe to me the difference between a Catholic approach and a secular approach today in patient care.
Well, as you're talking about we're spiritual, we have mind, we have a body. If the healthcare profession only treats the body and doesn't take into account our spiritual side and our minds, they're only treating 1/3 of the human being. And so the Catholic view of healthcare tries to encompass all of this. It is not just the sciences that help us to a healthy life. Theology also helps us to a healthy spiritual life. Philosophy helps us to a healthy life of the mind. And all those together work towards health.
Mm-hmm.
Yeah, I certainly agree with those comments by Louise. One cannot separate or ought not to separate care for a person bodily from the afflictions that exist spiritually, emotionally, psychologically. Just on the face of it, it doesn't really make a lot of sense, right?
Mm-hmm.
Because we're not just body. We are a composite, a unity. Composite is not the best word, but we are a unified, integrated one person with these various dimensions. I would like to add, though, also thinking about this, that if we think of the end point, the telos, to put it in a philosophical term, or the purpose of medicine to restore the person, the patient before us, let's say in a clinic, the purpose is to bring about the good, to restore that patient to goodness, human flourishing, that they feel well, that they are right in their relationships with their family and others. And if we keep that in mind, that is the point of the purpose of medicine, we would fail terribly and fall very short if medicine, in trying to achieve that purpose, did not pay attention to these other dimensions, the spiritual dimension of the patient.
I believe holistic care comes from a Christian point of view, of looking at the entire person, because we understand as we are taught through the magisterium and the teachings of many, many holy fathers, that the soul, the mind, and the body are intrinsically, and that word is so important, intrinsically bound together. And I often will explain it in a way that we can think that we have this physical body and the soul is kind of slipped into the body, like there's a canister and we slip the soul in and it slips out at death. But that's not the case at all. Yeah. It's why we have a quote-unquote agony, our last quote-unquote agony, because the detachment of soul from body there's such an unwinding of the meshed networking of how God created us that we aren't just slipping in and out of soul, body, mind. They're together. One affects the other.
St. Thomas Aquinas said that we are an in-souled body or a bodily soul.
Mm-hmm.
The soul is the form of the body. Without the soul, you wouldn't have. It's not a human being; it's a corpse. So they're tied so tightly together that if you pinch a person's arm, they're going to say, "Why did you pinch me?" Not "Why did you pinch my arm?" Mm. Our bodies and our souls are one.
Mm-hmm.
Yeah, and I can't help but thinking of how nicely St. John Paul II, in his beautiful catechesis on the theology of the body, really illuminated that. This is not new Catholic teaching, that is the understanding of the human person, but I think he took us a great deal forward in helping us to understand that we are bodily, ensouled bodily creatures, that there's not this dualism, this separation, like the canister analogy that you gave.
Mm-hmm. We could see this in something like the 12-step programs. You know, when there's healing from an addiction, it's very obvious and evident to those who are healing that you need the soul to be healed as well. The soul has to help the body heal from that addiction. It's the first several will acknowledge that I can't do this by myself, that those who are suffering an addiction must hand all over to God, and that He will be their assistant. And it is the same in all disease. So do you see in the disease process going toward wellness that a person's mind and their prayer life will affect the outcome?
That certainly is the case, and I know that there is much data surrounding that in terms of physical healing as it relates to people who are more in tune spiritually, who pray, who are hopeful, who believe. So, yeah, there clearly, there are empiric data that support that benefit of paying attention to the spirit. And
so how about the healthcare providers? If their mind is hopeful and they are Christ-directed and they are really even praying for their patients, what do we see then in the physician and the caregivers as different than those who may be secular?
Well, again, I would say that it's augmented care. It's enhanced. It's more deeply enriched care if the physician, the nurse, the healthcare provider, the physical therapist are of a mind that is tuned into the spiritual dimension, to their role as part of the body of Christ. For Christians to help this patient before them.
Can I give you an example that I might think that this is a secular hospital that I'm talking about, Jefferson Hospital down in Philadelphia, but this example will kind of give you the idea of that holistic, even including the family. And when this beautiful, Christ-like, we're going to care for the patient, for the family, and do everything to meet mind, body, and soul, the difference that it makes in the moments that are difficult. My son was in a car accident many, many years ago, and he broke his C2, his second cervical disc in this. He was just a passenger. It was an innocent mistake that the driver made on a left-hand turn, but my son took full impact. It was the most terrifying ER visit that I've made. One of the doctors was crying in our local because what could have happened was total paralysis from the neck down. He was helicoptered to Jefferson. My husband and I had to drive. He was back in the examining room for about 30 minutes, which was the longest 30 minutes of our life. But when they opened that door, we were at the end of the hall. I had the ER doctor, a neurologist, several residents, and the nurses. As we were walking down the hall, they were coming toward us, yelling, "He's okay. He's okay. He's going to be fine." They were already grabbing our minds before we ever took a look at him behind that curtain. They knew that what we needed as much as what he needed, and they went right to our minds and our hearts in the care of my son. So when we look at these circumstances, and Dr. Trevelyan, you are a pulmonologist, so sometimes you're given pretty hard news to people.
Yes.
And that delivery and meeting them where they are and knowing the full understanding of where the spouse is, where this person has just been thrown into the first stages of grief, as we know by Elizabeth Kubler-Ross. We know you're throwing them in with that news. Knowing that understanding and your approach and how you will follow up, your follow-up is going to be the Christian care that surrounds your scientific care. How does that come out in the real world?
That's absolutely true. I mean, I think it's about, let me back up for a second. Jesus Christ is the divine healer. And when the physician, the provider, to the patient is open, is in tune with that reality that Jesus Christ is the divine healer, and the provider's in tune with that, then that compassionate, empathic care, the words that are spoken, the body language that is used, all of that, the gaze, the silence, all of that comes to bear in an important, good, healing, restorative way. Flows. One way to think of it might be flows through Jesus Christ, flows through the provider to the patient, to the patient's family.
It reduces isolation. In that moment, a person must feel totally isolated in their circumstances. But that love that you're describing will reduce that.
Absolutely.
And then open to hear, where do I go from here? What's my next step? And giving hope to be able to take that for healing and wellness.
It's the provider. Yes, it's the provider being open, stepping aside in many ways, or being the instrument, to put it in an often used metaphor of how we think about being the instrument of Christ for the patient, for the patient's family.
Now, this is important enough that the two of you came together to write a almost textbook-size volume of physicians' experience of first using scientific truth and scientifically medical science of presenting the way to care for patients that will come to each physician in different disciplines of medicine. What brought you to want to do this? What was the desire for formulating this idea for this project?
There's been a long history, at least in American medicine from the last century, of, and shall we say, the modern era of medicine, maybe through the early 20th century, a long history of Catholic physicians who recognized what we were just speaking about a moment ago, about the spirituality dimension, the spirit dimension of the patient, who recognized the importance of that and recognized deeply that for them to be conduits of the divine physician to their patients in medical care and practice had to be themselves prepared. And so early on, physicians found themselves connecting with spiritual advisors, priests in small groups, maybe in their parish, pockets of their diocese early on. And this connectedness of those experts, if you will, and clergy and spiritual directors with physicians sort of gelled and took off, and there were many of these so-called guilds that began to be formed, and so regular meetings and conversations and sacraments, mass, notably among these groups of Catholic physicians. And this movement, if you will, continued to grow, so much so that the Catholic Medical Association eventually was formed, named as such, in, I think, late 1990s.
It was originally the Federation of Catholic Physicians Guilds from way back in at least 1932, and it changed its name in the 90s to the Catholic Medical Association.
So, yeah, in the 90s. So the Catholic Medical Association, there was a very prominent physician early on in the 90s who put forth a textbook that had to do with Catholic ethical principles, and it was geared for the practitioner. And so fast forward a few years later, the then president of the National Catholic Medical Association, knowing, as many of us did, about this book, had suggested that maybe it was time, this would have been about 10 years hence, maybe it's time for us to update or to put out something tangibly for Catholic physicians that speak to this, what we've, in a sense, and our ancestors, if you will, in a sense, have been doing for over a century. That is coming together, recognizing these values of faith, and infusing, being infused in their practice and their care for patients. So that was sort of the idea, that we wanted to come up with we wanted to have something to present to practicing physicians who were interested in practicing in an authentically Catholic way. So that was sort of the idea behind this book.
Now, you have included what I would say is the really challenging disciplines that are interacting with politics and interacting with philosophy of the age, where physicians can kind of get pulled into that and pulled away from what their basic knowledge is, because they have so much coming at them of what patients are demanding and what the law is demanding of them and what they are and are not allowed to do, or what they should be doing, which might cross their own consciences. And some of the disciplines that are included in this book are the reproductive areas, fertility, for the pediatrics, older adults, for the critically ill, which we certainly know that there's a lot toward the end of life, even though critically ill does not always mean the end of life. For Catholic surgeons, rehabilitation medicine, and Catholic psychologists. And very importantly, the Catholic pharmacist. Wow. I look at each of these disciplines, and there's so many hot potatoes in each one of these that a doctor has to be able to navigate today and still do his job or her job. So let's take a look at one of them, and that would be first the reproductive area of healthcare. That being an incredible challenge for a Catholic. I have known doctors who have even avoided the practice to not have to get into some of the difficulties. And I certainly know many who are leaving the practice of obstetrics and gynecology because of the challenges that have nothing to do with how they care for a patient, but have everything to do with what they are being asked by society or by the law. So that's even chronologically in your format in the book takes primary place. Why is that? What are these doctors dealing with today?
There are a number of issues, as we all know well, surrounding reproductive care in medicine. And again, getting back to what this book was trying to do, and I hope provides, is a view of how to practice and take care of patients in an authentically Catholic way, which is just shorthand for saying a way that pays attention to what is truly good and beautiful about the human person, so for example, in that chapter on reproductive medicine, the author will get into a number of issues, some of which are very, as you said, hot button, sort of hot potato issues with that we know well in the beginning of life, but gets into genetic testing, for example, certainly contraceptive practices, but provides, as you suggested, the science, the underpinnings, the scientific truths for these these aspects of care. There, get into in vitro fertilization. Why is that an issue ethically? That's to be found in this chapter as
and
well.
it gives what I like about this is that it gives the medical information as well as the theological, which go hand in hand, truly. And you mentioned the theology of the body, which I would say that if you're a Catholic doctor, or the spouse of a Catholic doctor, or children of this doctor, to really encourage a closeness with Christ through prayer and sacrament, because you will begin to learn and understand to look to the church as an adjunct of your knowledge. The theology of the body is beyond brilliant, because what it is basically saying, it took me a little while to understand the theology of the body, to get it kind of out of like, there's a new book on it, and actually read the book and understand it. And that is, God put into our bodies almost a speech that tells how morally we are to behave. And if we cross that, we will have consequences. Let's look at reproduction. In a completely normal circumstances of matrimony, usually not looking at widowhood at all, but there is one man, one woman. And the woman's body does extremely well with that in terms of health. If we go outside of that, and there are multiple partners, we are going to see an increase in cervical cancer, in disease, in a depression. There's so many consequences to not living the matrimony that the church teaches us. Yeah. Dr. Trevelyan, you want to say something there?
Saying, I mean, it gets to what I sort of said there about the truth. So what was truly good, what is true, what is really true about the body, it makes perfect sense then that living in accord, practicing in accord with the truth, the goodness that I mentioned earlier, the end point, if you will, of what we ought to be doing in medicine when we're confronting disease. But in the cases of just reproductive health, it's not really an issue of disease as much as it is counseling and having, young, healthy couples abiding in an abiding way, according with what's good and true.
It's hard for physicians, though, because what they are seeing is, they have compassion. Physicians have compassion, but there is a false compassion. So to have a book like this that kind of grounds you and encourages you to believe more, because it's that belief in God and His principles and His truth, scientific, moral, and otherwise, that will strengthen you to give what is best for the patient. We're talking in the area of reproduction right now, but to overcome the fear of society saying, I really should have that contraception, monthly contraception plan of chemical change in my body because this is the way I want to live. But when you hand that out, it's not good for her, because what's going to happen is a tremendous increase in cancers and many, many consequences, blood clots, lots of things that are going to happen. And yet there's a pressure on the physician to be able to not counsel her correctly. He might lose a lot of patients that way. There's so much coming at him right now. But when you really come down to this prayerfully and understand that one works, the faith works with the science, and that I have a kinship with others who are living and they're practicing like this, the strength will come and the best will be done for the people.
One thing you find in that chapter especially is that there is a more detailed explanation of the human body and its workings.
Definitely.
So contraception kind of covers up problems rather than solving them. And our Catholic approach is, ironically, against what you would normally think, is to look more closely at the human body, at what's happening. Is there a problem with endometriosis or something like that? Are there physical problems, actual problems that we can address rather than covering them up with contraception and with other things or replacing them with IVF. Are there ways that we can actually heal the body and by looking at it more closely rather than using medical intervention, chemical, pharmaceutical interventions?
And Louise Mitchell, I will tell you that you have spoken very truly, because it was through openness in prayer and closeness to Catholic teaching that brought about that science, especially in the realm of naprotechnology by Dr. Hilgers, he was open to not just what was coming from his professors, but thinking, but what's God's plan for the human body in terms of women? And he looked at that cycle, the woman's cycle, and he studied, and it takes courage to go outside of what you have been taught by your many excellent professors who are very knowledgeable, because you might be called, well, this is medicine that's outside the realm. Your alternative. It's not alternative. It's actually should be central. By doing that, he was able to know that God put a language into the woman's cycle, and you could read it like a book. When you do this, you can read it like a book, and it's a great tool for a practitioner who just wants facts quickly to look at a woman's chart when she is charting correctly and be able to diagnose or have it as a tool of diagnosis by reading her chart. That is what I'm talking about. He had faith enough to broaden what his professors were saying and study that for years before he even presented it to the first woman.
Patti, you mentioned earlier in the theology of the body, you said that the body, and John Paul would talk about this, speaks a language. It's called the language of the body, like a body language, but there's a very precise language of the body. And there was a nice comment that you made about Hilgers being able to read or understand that language that was being spoken, that language of truth about what the body is. Because just like in speech, we can speak truth, we can also speak falsehoods, and but recognizing the truth and understanding that language of the body and what's true is very nice.
Now, Dr. Trevelyan, we don't have those letters directly from heaven all the time when we want them or need them. We're really making our way through. So to take what has been given to us in the theology of the body and to know that prayer, the opening of the mind, heart, and soul, and the gift of knowledge, because those we learn those vocabulary words in 7th and 8th grade when we make our confirmation, and back then we've memorized them, but we haven't really experienced the need for them yet. But when we are in our adulthood, those gifts are precious. The gift of knowledge, the gift of understanding. For a physician, for medical practitioners to open themselves up through prayer, adoration, sacrament, reading, spiritual works, to open ourselves up, you are going to have a greater gift of knowledge and understanding when it comes to your own profession. I could probably say this about all professions across the board, but specifically this one where God is working through man to heal others. That there is a way and there is a method, but we have to be able to step a little bit out of our secular knowledge. Don't forget your secular. You need to know the placement of the bones. We can't forget what's going on here. But there's so much more, and there's better care. And I think it affects a physician more when he does things correctly than when he is doing something that is wrong, because you're going to shut down your moral conscience. Because a mortal sin is going to do the same to a doctor that it's going to do to anyone else. And it's going to shut you down, and you're going to not feel those feelings of knowledge and understanding as much. And you'll be in the dark. And then the secular world makes a lot more sense. So, but looking at this, in terms of your knowledge, Dr. Trevelyan, as a pulmonologist, let's just take a scenario where a woman comes in with blood clots in her lungs. And you just really have not had the ability to know that there are other reasons that this could be happening. would it become in your realm that you would put together a reproductive answer or consequence to what is presenting in a pulmonary condition?
Oh, well, certainly. I think you're getting at, I imagine,
Yes.
the use of oral
Yes.
hormonal contraception, which we know is a substantial increased risk for blood clot formation in the body. And then once blood clots are formed, a high incidence potentially for life-threatening embolization. We say blood clots that travel to the lung and in some situations are life-threatening.
Mm-hmm.
So, I mean that's clearly recognized as one of the complications. And then, in an appropriate time in the care for that patient, it's incumbent upon the good physician to inform the patient about the risks and the ongoing risk should she continue to use oral hormonal contraception.
How about doctor to doctor on that circumstance? Is it comfortable to be in the cafeteria and ask to talk to a gynecologist and say, you're 80% of your practice is contraception, and yet I'm seeing some of the consequences. How do those conversations go in a Christian way?
Yeah, they're certainly not comfortable conversations, but as a Christian, I think we need to, as it was told to me quite some time ago, we need to become comfortable being uncomfortable.
Yes. I find that as well as a hospice nurse, because things can, there can be attitudes of excellent nurses who are incredibly loving and caring, but in a difficult circumstance could give in a little bit. To actually just one-on-one, just by me encouraging them or speaking about life, will assist them to kind of rise back up to where they should be. And sometimes it is uncomfortable because they kind of know me as the Catholic one. And I have to embrace that versus, being made to be like the goody-goody. I have to embrace it and go right for it. And they always appreciate it when they come out of the difficult situation that, thank you for sending me that prayer, or thank you for what you did, because it got me through that circumstance.
Yeah, and to the degree that we can all become better and better at explaining and the science, for example, in medicine, the truth that underlies why certain, quote, teachings of the church exist, I don't know if it's easier, but certainly the better it is in terms of helping people to understand, because we're all rational. We can understand the truth.
Now, the book that we are talking about is called Catholic Witness in Healthcare, Practicing Medicine in Truth and Love. And the subtitle is really indicative of what this book is about. It is in practicing medicine. There's practical advice here, where I don't think there's a physician that is in the United States or perhaps anywhere that has the time to review every other discipline's concerns in a way that would be meaningful. But this, in the way that you have presented this, gives them the beginning of knowledge and understanding of where they can read a chapter and then take it further in their own studies. But just the chapters and the information that's in each chapter directs them to begin a rethink of maybe where they were caught up in the kind of a secular understanding of where medicine is. I mean, you put 20, 30 years into a profession, you're just moving along with it by then. Sometimes we have to kind of stop and reassess. Am I where I want to be? Am I where God wants me to be? And am I in the best place I can be right now? And this is a book that is going to really give a push to that in a convenient way. It's convenient to read this book. I like it because each chapter is independent of the others. I always like a book. In this time and age, I can't always read from page 1 to, and what is this book? There's 500 pages. But to grab a section out of it, I can do a section in one night. And that is very, very helpful, especially if it's like interest driven. something comes up in your day, doctors, that someone has said, a Dr. Trevelyan has sat down next to you and said something about, well, those contraceptions that you've been prescribing. I saw a girl with this situation. We had a naprotechnology nurse here on the radio, and she described a woman that she encountered who was working in Princeton. And she was walking down the street on her lunch hour, and she had chest pain that was extreme. She was in her 20s. She knew enough to go around the corner to the old Princeton hospital that was right in town. They did x-rays. She had thousands of micro embolisms, tiny, tiny little blood clots in her lungs. She was in the hospital for weeks to try and control that. And it was because of taking contraception. Now, to have that conversation with a practical, situation that you've just had with a woman that came in, to say to the gynecologist, this is what's going on. Should we be rethinking this as doctors? And if you just had that conversation, picking up this book of the Catholic Witness, you can scroll through this and you're going to find out why this is happening and why you can say, no, this is not best for you to a woman.
One thing about this book, I teach a class in medicine and bioethics at the University of Marion, North Dakota, and I was looking for a textbook for the students on Catholic clinical medicine. And I was working on this book at the same time, but it wasn't out yet, so I couldn't use it. And I couldn't find another book like it. I couldn't find another book that, from the physician's perspective, showed how to be Catholic in their profession. And as soon as this book came out, last fall, I was able to pull a few chapters for my students, and this fall hope to pull many more. It's just a unique book, and it starts out with 3 chapters on the basics of Catholic medicine, on our concern for the dignity of the human being, on a proper Christian understanding of anthropology, of what the human being is, and on the sacraments and their use in healthcare. And one of the good things about that front section is it talks about suffering. And, of course, we as Catholics know that Christ suffered for us. And we know that suffering has meaning. It has purpose. And that's not something you'll find in the secular world. And so when we come to, say, end-of-life issues, where one of the reasons that people say we should have a right to physician-assisted suicide is because of the great suffering at the end of life. Well, we, as Catholics, can say, but that suffering is redemptive. We can add it to Christ's suffering, and we can pray for the people around us and use our suffering for something good. At the same time, suffering at the end of life, John Trevelyan and I have co-written an article with a few other people about how suffering in almost all cases at the end of life is able to be relieved in some way. So that's not the main reason that people want to take their lives at the end of life. One of the main reasons is they don't want to be a burden to other people. Yes. And we know as Catholics that no human being is ever a burden. Every human being is unique, created in the image of God, totally has huge value. And for someone to think they're a burden, that means we've failed that person in our relationship with them. Mm-hmm. And so part of one of the chapters in this book talks about accompanying people at the end of their life, accompanying them, being with them, not abandoning them. That's the Catholic way to view end of life.
Absolutely. It's a crisis of love.
Mm-hmm.
If we are allowing people to feel that they are a burden at the end of life to the point of wanting to commit suicide.
Mm-hmm.
And that is what we see in Oregon. That's what the statistics are showing us, that it's not pain control, because we have that. Mm-hmm. We have pain control. It is not, the difficulty of breathing. It is that fear of being a burden, of losing dignity. But dignity very often, comes from God, and it comes from others affirming your dignity. what the answer is, we need more nurses, more doctors. We need more people in the health profession, in institutions that will care for you. It's going to mean, honestly, a revamp of everything as we know it today. When I say today, I mean 2018, because things have been changed dramatically. A hospital stay is days versus weeks, where you can really help someone in that environment. So a lot is moving toward the home. We need to have the personnel to go to the home.
That's more about the subtitle, the second part of the subtitle, practicing in love. We talked a lot about practicing in truth, letting people know what the science, the truth is, but practicing in love addresses a lot, as Louise was saying, these issues where, and as you said, Patti, it's really a crisis of love. People, John Paul II said in Evangelium Vitae many, many years ago in that beautiful document, that people's wish, even when they wish to end their life by suicide at the very end, is really a plea for love.
Yes, it
is.
is.
Really a plea for love, not that they want to be dead.
Absolutely is.
It's a plea for love. So there's a deficit there. And so practicing medicine in truth and love, we hope this book will help our fellow healthcare providers
and there's
the patients they care
really
for.
much to be helpful. I'd like to read one of the paragraphs under the spiritual perspective in rehabilitation medicine, in which the author Jose Santos says, "The Catholic faith is rich in resources for forgiveness and healing, but it does require two things of Catholic physicians. First, it requires them to ask patients to submit to God's will, following the example of Christ's prayer at Gethsemane, quote from Jesus, 'My Father, if it is possible, let this cup pass from me, yet not as I will, but as you will. My Father, if it is possible for this cup to pass without my drinking it, your will be done.' Second, it requires that physicians renew and acknowledge their faith in the healing power of Christ." Dr. Trevelyan, I'd like you to speak to the physicians who are listening to healthcare, because there is a point when you know that you've done all you can medically. How does a physician really face those words of Jesus? You can ask for help from God, but it's going to be God's will one way or another. How do you help physicians with that so they don't run away? Because the pain is hard and the circumstances are too real and too difficult for them to go to the next patient and still have the ability to stay on task. How do you deal with that? I've done everything I can point.
Oh, there's no easy answer to that. For the physician who's tuned in to Christ, the divine healer, I think the physician in that difficult situation with the patient for whom there is nothing else that can be done remains with the patient and accompanies that patient and perhaps is there with the family who may also be there, but is there with the patient primarily to see that death is as peaceful as can be done, as can be, and that everything is done medically to help that be achieved. The difficulty, I think I heard you asking, was how do you get other physicians or help other providers do the same for their patients? And that is certainly more challenging. My answer would have something to do with being a witness yourself. That's the most powerful thing I could think of, that we witness to others how to accompany patients, and hopefully then follow it up with maybe dialogue and education, conversation, hopefully in witness to others then too will provide along the same lines that
They
kind
will,
of care.
Dr. Trevelyan, because as I can attest to you, that the nurses, because the doctor cannot be at the bedside 24 hours a day. It's brief. Your visit is brief. So how do you have all this, influence with a brief moment? And it's through the nurses. Because a nurse will say, well, Dr. Trevelyan expects this for his patients, and we do it. Whether it could be, even if it's a type of catheter that he prefers, whatever it may be, we know what he prefers. We know what he wants, but we will also know what his expectation and care is for his patients. So it is really becoming that light of Christ to the patients, the families, the nurses who are going to rise up to what you expect of them for their patients, and every single person that comes in contact, because they will know your love and care and high expectations for each and every person. So to develop that Catholic understanding inside and your own spiritual life through prayer, sacraments, and good reading and fellowship through the Catholic Medical Association, this is how you can take one step up, 2 steps up in your practice. And when you go home, there's going to be more fulfillment. You're going to feel you made a difference in the day. Not just with, yes, test results look a little better, but no, everything's looking better. Everything. Everybody in the hospital will look better. So,
Pope John Paul II called on physicians to humanize medicine. And we do that by recognizing that it's not a bunch of bones or biology or chemistry, but that is a relationship between 2 human beings, both with equal and infinite dignity. And that is how we humanize medicine, practicing in truth and love.
Excellent. Listeners, I would recommend that you get Catholic Witness in Healthcare by Dr. John Trevelyan and Louise Mitchell. Buy a copy for your own physicians. If you know them to be a Catholic doctor, this is a gift. It would be a treasure to them. It would not just the content, but knowing that their patients respect them enough to give them a gift and say, keep living like a Catholic. Use the gifts you've been given, doctor. So thank you very much to both of you as distinguished guests today. I really do appreciate that. And thank you, listeners. God bless you always.